There are setbacks in the healthcare sector. To begin with, resident doctors recently embarked on a 7-day strike over the incarceration of one of their colleagues, Ganiat Popola. They say this is one amongst many other kidnappings in the country. They are also concerned about security at health facilities to protect the lives of health workers and patients.
We're doing everything to secure the release of Dr. Ganiat Popola. I was just in Kaduna last week to visit the hospital. I went to the staff quarters where she was kidnapped from. I spoke to her husband. I was meant to have an in-person meeting with her husband, but unfortunately, because of some logistic issues, he couldn't come. But we spoke. And I want to reassure the family that this government is determined to secure a release in safe health. And the National Security Advisor is also on this. He's promised us and he's assured us that this is one important thing that is also working on top of the millions of other important things that the NSA has to deal with today. Not president can say whatever he wants to say. We have security, armed security at our hospital. I'm not telling you, I would like you to go corroborate what I'm saying. Go to Jabi, go to any of our federal tertiary hospital, go to say, well, there's security there. But the police are meant to do other things. We can't turn our policemen to be the gate security at our hospitals.
The National Association of Nurses and Midwives recently issued a 15-day ultimatum to the federal government to improve their welfare following the increase in the price of goods and services. They are demanding that the verification portal for nurses be reopened so that nurses can migrate at will.
We're working on expanding more welfare to the entire workers of the country. The president has done a lot of other interventions. I'm telling you, let's look at it. Please, give me a minute. Let's look at it. We have a society. We have it's a whole of a society approach. I'm advocating for healthcare workers. But then, the president has the entire country too. They're getting all their extra allowances now. Can we do more? Yes. We're going to do more. The president is also working, has given us some verbal approval on how we can do more domestic resource mobilization. I'm not aware of any portal being closed. It's just that what's happened before, people just log in, they want to apply for letter of good standing today and get it tomorrow. We've stopped that. We're following process for you now to go. If you're a nurse today, you've traveled to UK or you want to go, if you want to get your letter of good standing, we said, wait, we have to do internal verification. You can't submit a request for letter of good standing for me today as the registrar, as a worker in the nursing council. There are a lot of people sending the same request in. We need to go back, verify that you went to the school you claim you went to. We need to go back to verify that you've gotten the experience you said you've gotten. It takes time. You will get your letter of good standing.
Bill Gates was in Nigeria to show support for pregnant mothers by donating 3 million multiple micronutrient supplement as part of efforts to combat maternal anemia and potentially save lives. However, some Nigerians on X platform have scrutinized his efforts, with some making references to conspiracy theories and questioning his concern for pregnant women.
Mr. Bill Gates is a global philanthropist, a very good man that cares about our country, cares about our continent in Africa, and cares about the world. We have to commend his generosity too. We've paid for our own MMS, multiple micronutrient supplement. Several states have been covered. You could go to our primary care center there. They are there. What Mr. Bill Gates gave us was just additional. It wasn't that we didn't have, and we haven't distributed these MMS. He just gave us top up that if you need more, I'll donate 3 million doses. Any MMS that is being sent out, it's certified by NAFDAC. NAFDAC. We work so closely with the DG of NAFDAC. Every single MMS that is being distributed to any of our primary care centers for the use of our pregnant women.
The minister reels out plans by the federal government to make the healthcare sector more attractive.
The first time we're working to eliminate malaria in our country. Before we've been palliating and maintaining malaria. We've put a concrete step together now that how do we begin to eliminate malaria? It's been done in other countries in the last decade. We can do that as well. I've met with the Pharmaceutical Manufacturing Association. They assured me that prices have come down to some level, but is this where we want those prices to be? No. We want further reduction in those prices. And I can assure you, with the executive order being signed, with us completing work on the harmonization implementation framework that will be signed off by the Attorney General in the next few days, people, our manufacturers will begin to now see the benefit of this of zero tariff that has been graciously approved by President Bola Ahmed Tinubu.
The challenges in the sector only present opportunities for the federal government to focus on taking a solution-driven approach to growth. Nigerians want to begin to see the development in the sector. Olije Wapera, Arise News.